Thank you for coming. My name's Dan Wilson, and I'm with Compassus Hospice and Palliative. What we're going to talk about today is the difference between hospice and palliative care. I'm not a clinician. I'm not a doctor. I'm not a nurse. I'm not even a CNA. I had my insurance license at one point, but that has nothing to do with healthcare. And we, um, with that being the case, I'm going to aim to give a layman's overview of what these are and what they are not. What you have to let go of on one side in order to pick up this care on the other side, and what I've seen in the few years that I've done this work as examples. Please, please raise your hand and engage if you have questions, because those are the pieces that are most vital to those who are watching the video. What your questions are for caregivers and for staff at the Family Caregiver Support Network, and the long name of everybody else who is here. Before we get started with the overview that you have in your hands, what question or questions did you guys come with? What are the main questions you have about hospice or palliative? Oh shoot, you broke the mold. Please, Jennifer.
Oh no, I was gonna say, does the person that I'm caring for need to be actively dying to be on hospice or palliative?
When does it happen?
Yeah,
What's the timeline?
right.
What's going on here? You would be surprised, as someone who is a hospice care consultant, which in other industries are marketing or admissions or sales, but I explain the business process. You would be surprised how many times just last week I sat with someone and I said, "What's your greatest concern?" That's where it starts with. And that's really what hospice is about. What's your greatest concern for today, because you've been given the worst news anybody can get? And the question the guy asked me, and his wife, he said, "My cancer doctor told me that the treatment's not working, and so the cancer doctor said we're not going to do treatment. And my cardiologist told me doing what he wants it to do, and so we're just not going to do it. And then they told me you're going to call me." And he goes, "Am I dying?" And that's a big door that there's not a human alive who understands what's on the other side of it. And I can tell you, if you've been given an order for hospice, I told him, if I'm here, if I've been given an order from a doctor for hospice, that means the medical professional thinks medical science guesses you have 6 months or less to live. And it was a 45-second pregnant pause. Because and so if you're watching this video and that's the place you're at, turn the video off, because that's enough to wrestle with for one day. Come back to the video tomorrow. So if you've been given a hospice order, that's what it means. That's a great question. And it leads into the first page on the attachment that I handed out. A quick guide for what hospice is, the general guidelines that go into them. Hospice is typically appropriate for individuals with frequent hospitalizations, progressive weight loss, deteriorating mental capabilities, and there's a distinction with that when it comes to dementia and different types of dementias. There's guidelines that go into it, but reoccurring infections, specific decline, and the last one is the one. Hospice is not legally supposed to continue being in place if you're not declining. There's many hospices that do it, and then they fight with Medicare, and there's financial things that they go back and forth. But hospice is for people who are currently declining. And technically, if you stop declining, which happens often, people get their medications switched around or they get them cleaned up and they don't have the overlapping, and people start putting on weight. They're not being told they have to go to the ED once a month or once every 2 months because of something going on, and they're always having some other type of treatment that they're trying to get better. And when there are times that as people get those sorted out, they actually graduate hospice. Um, but often, I mean, science is pretty smart. Like the scientific method works, and by the time someone has uh, been given a hospice diagnosis, often that's the trajectory we're on.
Go ahead. Oh, I was going to say, so really someone could be on hospice, have a turnaround, get off of hospice, and then go back on hospice. It's not necessary. It's a guess that they think it's 6 months or less. It's not a guarantee.
Yeah,
Because
I've
I
had
think that's a lot of times people don't want to talk about hospice is they think, oh, that means we only have 6 months, so we don't even want to talk about it because then that confirms it. But explaining to people that it's not a guarantee that 6 months, it could be longer because there's been people on hospice for a year or so.
or years.
Yeah.
I mean, technically, depending on the company, sometimes they'll graduate someone off hospice and then put on palliative care, which is like doctor NP nurse call once a month. So we'll come back to that in more detail. But often, well, okay, often that's a description of a percentage. Um, a lot of times the human body responds and bounces and looks like it's doing better even when someone gets on hospice, because they're not always pushing themselves to get better. They're not always putting poisons in their body, which is what chemo and radiation is. Um, Dolly, did you have a question?
Mhm. So just to clarify, is hospice when there is a diagnosis that's showing that it's not likely for them to get better, and that's the treatment that they follow? And then palliative care is when like treatment is still being given because there's a likelihood of the illness being treated, but they need the same kind of care, the same level of care. Is the care the same? Just they call hospice? No? Okay. Could you tell me a little bit more of the difference between the kind of care you would receive when you've been given a hospice care recommendation versus the kind of treatment that you would get when you have palliative care as the recommendation? And when would your doctor give one over the other?
Nice. Dave, I think Dolly's been reading ahead in the notes, and I think that's what's taking place. I love your question. And so it brings us to the lower right corner of the first page of the handout, which is what is included in hospice versus what is included in palliative. Hospice, there are 5 primary disciplines. The lower right corner, it looks like a pie graph. Those are each a role a different member of a hospice care team plays. A hospice care team is primarily run by the nurse. Nurse runs the team. Under her, there's an LPN, there's a CNA or an aide. An aide will come out a couple of times a week, typically to start with. A nurse or LPN will be once a week, once every 2 weeks. You can but you get a social worker and a chaplain once every 2 weeks, typically a couple times a month. Social worker you only need for a little bit often to get your everything lined up. But on top of that, there's a medical director who is a doctor available 24/7. Every patient on hospice has a doctor 24/7 that is available, so that if something happens, you don't just call the emergency department or you don't call the ambulance, you call a nurse, and the nurse will come out to you in person. There's also volunteers. There with hospice, there's 13 months of bereavement that you get for after a patient passes. which includes counseling groups, letters, points of contact. Uh, there's also, you see on here, there's physicians, nurse practitioners, and there's even therapists on this pie chart. Because often people give up their therapy, they have to give up their treatment to get on hospice, but hospice is about comfort, safety, and quality of life. And if that, there's times that therapy is required for proper care. And so there's the 5 primary disciplines. And the big difference with hospice is when, instead of going to the hospital and going out for your medical care, your health care comes to you. On the other hand, to answer your question, Dolly, and you can flip to the second page and the third page, which are kind of tied with hospice versus palliative care. But to answer your question, palliative care is a doctor or nurse practitioner visit every month for, a month and a half. And the idea is, if you're declining and you have an appointment in October as a follow-up, there's a lot that can happen between now and October. And if you have a doctor house call, if you have someone coming in and putting eyes on you and having the conversations and talking through where you at with this and how are you, going through, you probably don't get a full exam every single time, but a pointed check in and do the vitals if they need it. And the trends can be seen. And so the palliative care, there's different guidelines on what qualifies someone for palliative care, but the guideline, whereas hospice care is the 6 months or less in a terminal diagnosis, palliative care is a year. It pushes longer. So you don't have to be as far down the road as you do legally with hospice care. With hospice care, like Medicare, they're particular about the money they give out. They have very strict guidelines. But palliative care is a specialty. Just like there's a neurologist, you can have a neurologist and a cardiologist and a primary care physician and a palliative care physician or NP. Yes, ma'am.
So are you saying that you could be receiving both simultaneously?
Both hospice and palliative? No. Uh, the the big difference with hospice care, and the thing that you need to wrestle with when you're making a decision, is to be on hospice. You don't use the typical healthcare system. You give up going to the emergency department or going to your primary care physician or going to your cardiologist or getting chemo. You don't get, Medicare doesn't give money to both treatment and comfort. There's either a cure or getting better, that's the aim, or comfort and safety and quality of life. So if you're on hospice, if you're on hospice and you wake up in the middle of the night and the symptoms of your diagnosis are just not okay, you call the nurse and the nurse is there to talk you through it. Most hospices leave a kit at your house of medication so that if you need something, you go to the kit and they'll direct you exactly what to give, or the caregiver who's there on what to give. And if necessary, the nurse will come out and do a direct house call. If you fall and break your arm, medication is not going to fix that. If your bone is, and so you go to the hospital if that happens. On the paperwork side, technically hospice has to stop being the care being given, and you go back into your existing whatever insurance you have. You go to the hospital, but that's a paperwork thing. There's no hooks in hospice as far as sales hooks. If you sign up for hospice and a month from now, you're like, I want a different hospice, or I don't want hospice, or a day from now, the patient is always in control. You can say, I don't want it, and they stop it. Because it's a big decision to change your healthcare system. Did I answer your question, Dolly? That was a while ago. I talked a lot in between. You know what I'd like to do?
Hospice means that there's no other form of treatment being given to the client. It's just hospice and hospice alone.
Okay, so this will be one tangential answer before we take a break. Yes, what you answered. There are instances, if someone has more than one diagnosis, that it's possible to be approved for hospice under one diagnosis and continue to get treatment based on a different diagnosis. Again, I'm not clinical. I'm not but if someone, for example, has skin cancer, but they also have some type of kidney disease that are completely separate diseases. Often with dialysis, when you stop getting dialysis, you have days, not weeks, when you get off dialysis. And so it's possible to be approved for your primary diagnosis on hospice to be some different than, and you can get treatment for a different diagnosis, but it's a pain, and it's difficult to walk through, and there's not a lot of hospice that well, Medicare wants people on hospice to not be seeking treatment, but with anything in government and money, there are always exceptions to every hard and fast rule. That was a lot. Let's take a break. We're going to pause and come back in 5 minutes. This next section, we're going to dive deeper into palliative versus hospice, and some of the parts that are on the sheets themselves. We're also going to talk through kind of how if you do get on hospice, what are the markers? When do you go to the hospital? When do you not go to the hospital? Kind of how that works. And then go through the different diagnoses that lead that way, and kind of what the next steps are. But before we do, I did want to bring up the I didn't write your name down. I'm so sorry. Cheryl. Hi, Cheryl. I'm Dan. Are you willing to ask your question again? You would.
Yes, I was just curious if there were someone to help the caregiver transition from one to the other, or kind of help through the whole process, because I don't think I comprehend everything, emotions are involved. So,
Absolutely. Absolutely. And the grief brain is real. It is hard. No one hears everything that a doctor says to them. You're catching on a few things. Take notes. But typically, when hospice or palliative is involved, the point is to help connect you and help you plan. Our nurse practitioner or medical director on a palliative visit will help with disease planning and setting that out. It's nice when you're able to have private paid caregivers come in and help, but something that hospice is not the caregiver. Hospice is a task-oriented service. There's tasks that are completed, and that's not time-based. So if you find a hospice or a palliative that you like and you connect with, trust your gut. You know. Kendra.
Is it true, though, that you can get other supplemental care while you're receiving hospice care?
You can privately pay for whatever you want, but the difficulty comes with Medicare paying for it. that comes back to the answer for Dolly's question before the break, where if there's more than one diagnosis, that it's possible. But normally when you go hospice, you let go of your other services normally. So as far as an official, oh yes, I'm sorry, Dolly.
So, and I'm sorry if I'm reading ahead again, but I am seeing some notes about Medicare Part B, Medicare Part A. So when it comes to the very, very beginning of all of this, and there's been a official diagnosis, hospice has been recommended, will Compassus help with telling the folks you're on Medicare Part B, you need to be on Medicare Part A, go to your local SHIP counselor and make those changes? Or is that up to the individual to know what their insurance is and is not? Does the hospital, doctor tell you, hey, just so you know, we recommend hospice, but you're going to need to make changes to your Medicare coverage?
I wish.
Those kinds of things.
I wish the doctor would give that kind of information, but often it's the quick answer to Medicare A and B. Medicare A is for hospitalizations, and Medicare B is for the going to a doc, and it's a palliative care is a specialty, just like cardiology or neurology are specialties. Palliative care is a specialty of declining terminal diagnosis. But yes,
So does that
they
mean
will-
that's something that you would catch when somebody calls you?
a part of
You
the
would look at
admission
and okay, go on.
has to do with insurance. There's all those pieces are lined up, and there's people at every hospice that walk through that with you. You have to get the information. Sometimes if mom just moved here a year ago from New York and her address is still registered with Medicare as a New York address, the person may need to contact Medicare and say, we need to change mom's physical address to Colorado in order to receive services in Colorado. So that type of thing the person may need to do, but typically the insurance and all those pieces are managed by the hospice themselves. Yes.
So typically, is Medicare the only thing that pays for hospice? Or if you're like on a Medicare Advantage plan where you have another insurance also, do they pay for it too? Or is it just Medicare that pays for it? Like what happens with your other insurance? Maybe that's a dumb question. But
Oh, it's not a dumb question. When it comes to money and insurance, knowing all those details is wise. And they're listed how the money is split up and I couldn't speak to that because it is so individualistic and individual based. But if you have Medicare, hospice doesn't cost you anything. If you have Medicaid, hospice doesn't cost you anything. If you are on VA benefits, hospice doesn't cost you anything. If you're not 65, typically these services have a copayment. But when it comes to insurance, as soon as you say typically, there's immediately things that do not go in line with that. Because if insurance companies can save money somewhere, they do. And those loopholes take time to find. But the rule of thumb is hospice you don't typically pay for. There are exceptions, of course. Any other questions? It's good. It's good. Well, since Dolly already read through the palliative versus hospice, I guess we'll just continue on to the next section. Those were both included in this resource as something that you can read and resource later. There is the checklist back and forth, and there's descriptions. We're all intelligent adults, and you don't need me to read something to you. The fourth page in the 6-page attachment, it reads CHAP certified. Compassus is a CHAP certified company. The CHAPS is, it's when the state comes into a facility or to a company and checks everything and says, are you doing things by the rules? CHAPS, it does the exact same activity. It's just Compassus space for them to do it voluntarily. They're all the right side of the road all the way, which is why they're consistently 4-star on Medicare.gov. Which, if I can put in a plug, use Medicare.gov. I recognize many people that I give these trainings to are my age or older, and using the web is never as universally simple as many would think. If you just go to Medicare.gov and search for your provider, search for your home health company, your hospice provider, if you're looking at a skilled nursing, if you're looking at an assisted living, if you're looking at any of those, go on there. And those are real reviews that Medicare sent real patients and patients' families, and each one gets one. It's not like someone Googles it and is able to get all of their friends to come up with 35 different email addresses and come up with 35 different positive results that are with fake people. Use Medicare.gov. It is a good resource to tell you who's doing good work, and look at the history. Someone may be a 4-star today, but 2 years ago they were 1-star. I would say that's a good trajectory. But if someone's been a 4-star and they've been at 4-star for the last 4 years, that's a completely different company that you would expect to work with. So use the resource. Use the resource. I put CHAPS in there certified because that's the company I work with. And that's what that uses a distinction. But everybody has something unique. Get to know the people that you're considering. Please use Compassus because they pay my bills. But get to know the people. Ask the questions. There are no dumb questions. There are no dumb questions. You cannot go through the hospice process wrong. Ask the questions. Oh, can you turn it back on? Thank you so much.
With all the different hospice companies, how do you really know? Are they all good?
Wow. Well, okay. Growing up, after I had kids, I used to say single parents were my heroes. I had a partner and I just failed miserably they knew I loved them very much, but there's parts I just wish I did better. That was before I met hospice CNAs. Hospice CNAs are my hero. They are amazing humans. I picture on the other side of death, they're going to be like these superhero sized beings because they just they do the hardest work. That's the grossest activity for no money and no recognition. And they're always pulled 10 directions at the same time. And yet they almost all do it with this grace and beauty and almost just a humble capability that they've developed. And so when you ask, is one good and one bad? I've worked for a couple hospice. There's good parts and bad parts to both of them. But there's just about, okay, there's some in every company. But just about everybody I know who works in hospice, they're just solid humans. Death is scary whether you work around it all day or not. It's awful and it's scary and it's hard. If you have a patient that you've been with for 18 months and you've been providing care starting 2 days a week, bathing them and grooming them, and eventually 5 days a week, grooming them and bathing them for month after month after month, and then they die, and that's the design of the service, that sucks. You love them, and it hurts. God, it hurts so bad I just spit on the mic. Sorry, Jared. There's good and bad hospices, yes. Trust your gut. Follow what your instincts, because most hospice, they're done by folks that are real solid folks, because the downsides are real. God, that was heavy. Kendra, can you hit your mic?
Dan, so if you get started with a particular hospice organization and you're not happy with the services, how easy is it to move to another hospice organization?
For the family and patient, very easy.
Yeah.
You can stop it, transfer it, whatever, by saying, this is what I choose. Patient choice, 100%. There are no sales hooks in hospice. As a matter of fact, if like something's common when people get on hospice at the right time, when they do have 6 months ish to live, most people wait until there's 1 to 3 months because even when you're not getting treatment, people still wait to the end because they just don't want to admit it. They don't want to say the H word. But if you get on at the right time, a lot of times people are like, I want this one last trip. And you could put that together and that, I mean, I've seen the team make it to where they kind of help increase strength and capability, not because it's extending the life, but because they know it's going to be exhausting to get in and out of the car, to drive, to go to this person's house. And so you need to build up for it. And then there's a recovery period. But in that setting, if they were going from here to Oklahoma City, every mile from here to Oklahoma City, we would need to arrange a hospice company that services that part of the road so that if something happens there, that hospice company has all your charts, has all your information, and they know when you're traveling. So even when you're with a hospice, if you did that type of trip, we set you up and you have multiple hospices that manage your care every step of the way, and they know when you're there and they check in. A lot of communication because the patient is declining. And that kind of attention to detail is just a part of the service. So you're never stuck, but even if you choose that type of trip, you switch from one hospice to another. You don't have to set any of that up. You don't have to do any of that, but you're covered and you're never stuck. So thank you, Kendra. So let's go to the next to last, the penultimate, I love that word, page. And it says, call us first. It has the green, yellow, and red. If you are on hospice and you fall and you're bleeding, and I mean, if you feel like it's not that urgent, call the nurse, but you're never stuck on hospice. If you need to go to the hospital. But this is a guideline for the different stages of when you would reach out versus going to the hospital. Weight gain, sudden change in ability to walk, talk, or move. There are many factors and features that that go into this decision of going on hospice. But when you're on those, this is a quick guideline for when you would make a call versus a different direction. And the last page, it just gives a list of different diagnoses, non-cancer hospice diagnoses indicators. If I can encourage one thing, and it seems to be asking an impossible, seems to be asking the impossible, is don't be afraid of hospice. And I get why that's scary. And it seems impossible to say it, not to be afraid of something that is so clearly identified with the very end of life. And it's not, don't be afraid of death. I think being afraid of death doesn't help anybody. But I'm not saying don't be afraid of death. We all carry our parts and our religious backgrounds and but hospice is a service that the end of life, it doesn't extend your life. It doesn't shorten it. Most people die because their heart stops. And most people's heart stops because they quit eating and drinking. A lot of times when someone's on hospice, the family like, no, I tried to get them up and get them around and they weren't eating. And so we forced them to do this. And so then they started choking. And when the body does that, there's enzyme the body creates What you experience going through that is not what they're experiencing. I mean, every death is unique, but it's the same process. A lot of times people they see, those are different topics, but don't be afraid of it. There are beautiful deaths that when someone lets you, when they're 6 months, 8 months, even a year, that the end, the people let go of all the pain, all the fight. Sometimes that can overflow into many areas of life, relational, things that they never let somebody know. I'll end with one story. He was a counselor for a very prominent religious organization, and I was a chaplain. Here, I'll switch my badge. I was a chaplain for him, and I liked him. I was actually a chaplain for him and his wife. They were both on hospice together at a skilled nurse or assisted place here in town. And after his wife died, he told me the story of how he was a counselor and he counseled people, telling them primarily about their sexual choices, whether that was partner choice or timing of when you would have sex and when you wouldn't, and that's what he gave the majority of his life to, counseling people for that. And after I'd met with him, he got on hospice, graduated, got back on, probably over a year and a half. Saw him every month. And when there was a couple months left, he told me the story of how when he was a young preacher, he got his wife pregnant. And they had to go to their pastor and have a quick wedding at the pastor's house with no one else knowing. And he carried that weight for 60 years. 60 years. And he counseled everybody how that's a sin. And I guarantee you, if I didn't know him for as long as I knew him, he never would have felt comfortable talking to me. And to me, if you can let go of that weight for one day, let alone a month or a week, that changes how you pass through that big door. Don't be afraid of the service. I understand where the service leads, but don't be afraid of the service. You've already paid for it. And thank you. Appreciate you guys.